9, cellular and physiological response to injury, the role of the immune system. Learning objectives. Define the terms associated with the disease process and their significance. Describe the causes of cellular injury, the various ways the cell responds to injury, and facts that influence the body's response to injury. Explain the basic guidelines of universal precautions. Describe the four basic requirements of an effective immune system. Identify the two major categories of the immune system. Understand how the immune system functions to defend the body from pathogens and how it helps maintain homeostasis. Describe the stages of inflammation, its signs and symptoms, and how to manage it. Understand nutrition interventions for wound healing and types of immune response. Identify the types of autoimmune diseases, the organs affected, and how they develop. Describe transplant immunology throughout the transplant process. Distinguish between active and passive immunization. Discuss the relationship between malnutrition and immunodeficiency. Classify the types of allergic reactions and their pathophysiology. Explain the difference between food allergies and their intolerance. Food intolerance. Epidemiology, etiology, pathogenesis, clinical manifestations, and disease outcomes. This chapter provides the framework with foundation for understanding the disease process, the processes that result in cellular injury, and the characteristics response of the cell to injury are similar among many disease states. Humans are exposed to numerous pathogens as we eat, breathe, and come in contact with environmental objects and other humans. We are protected from disease-causing organisms by the natural resistance of our immune system. Natural resistance involves anatomical structures and physiological mechanisms that have other functions in the body, but also work to keep organisms from entering the body and becoming established within the cell. Disease is defined as a process that interferes with or disrupts the body's normal function. Disease or injury leads to a state where that balance is interrupted and homeostasis cannot be maintained. Pathophysiology is the study of the disruption of normal physiologic process. Pathophysiology includes understanding structural changes that occur as a result of disease or injury, as well as the clinical course that follows regulatory, metabolic, and structural changes. The clinical course of pathogenesis includes impact duration of the disease. Understanding disease mechanisms provides the basic foundation for treatment. It is common to organize the study of disease process by analyzing patterns of disease occurrence through epidemiology. Epidemiology is the study of the disruption of disease within populations. Epidemiology provides data for outcome measures such as morbidity and mortality and identifies risk factors associated with disease. Epidemiology commonly provides the first hypothesis for determining disease etiology. Etiology is the description and identification of the cause of disease. Etiology can be narrowed to be a specific causative agent or may be a combination of factors that influence or change disease development. Influential factors could be age, nutritional status, or other coexisting diseases. Etiology of disease can generally be characterized as genetic, acquired, multifactorial, idiopathic, and idiogenic. Diseases of genetic origin are those that are developed from abnormal behavior in genetic control of cellular development. These diseases may be either congenital, present at birth, or non-congenital, becoming evident later in life. An acquired disease such as measles is one that originates from exposure to environmental agents. An infectious disease may be classified as an acquired disease. Many disease processes treated with nutrition therapy are considered to be multifactorial. I say again, many disease processes treated with nutrition therapy are considered to be multifactorial. These etiologies include a combination of genetic, environmental, or infectious factors such as diabetes and osteoporosis. An etiology is considered to be idiopathic if the origin is unknown. Etiogenic disease refers to any illness or symptoms resulting from a medical intervention, treatment, procedure, or error. Clinical manifestations of disease become evident as cellular injury leads to systemic changes. Signs or observable phenomena can be verified. Signs are measurable and include factors such as blood pressure, respiratory rate, weight, or body temperature. Symptoms are those factors verbalized by the patient or caregiver and are frequently noted by the chief complaint in the physician's history and physical examination. Symptoms are subjective and their clinical values depend on the ability of the patient and caregiver to report this information accurately. Laboratory values falling outside the norm may include blood chemistries, urinalysis, or tissue biopsies. The outcome of disease is sometimes referred to as the sequel of disease. Prognosis refers to the expected or unusual or usual outcome of the disease. Complications could potentially occur as a component of disease outcome. Practitioners may be much more comfortable discussing clinical manifestations of disease than they are describing the underlying events at the cellular level. Cellular injury may result from physical injury to the cell, such as trauma, a deficiency of a necessary substance required for cellular functions, or interruptions of normal cellular processes after exposure to a toxin. Mechanisms that destroy the structure of a cell can include physical or microbiological agents, immunologic reactions, genetic defects, and nutritional imbalances. Hypoxia is a common reason for a cell injury. An insufficient oxygen supply will interfere with cellular metabolism. This is easily demonstrated when you consider the process of myocardial infarction, where a reduction in oxygen supply caused by a blocked blood vessel in a portion of the heart causes death of those muscle cells. Physical agents such as ethanol, poisons, or lead, and other heavy metals can cause cell damage through several different mechanisms, such as oxygen deprivation and destruction of cell membranes. Injury and disease can result in excessive accumulation of water, lipids, proteins, pigments, and minerals within the cell, which disrupts normal metabolism. For example, when a cell is unable to produce adequate ATP to maintain transport of sodium and potassium, fluid will shift, causing a disruption in fluid balance. Changes in cell size are both common and a central component of many disease states. Cells respond to a variation of hormonal or neurological stimulation by alteration in their size. Atrophy results from a disease in cell size, decreased workload, loss of innervation, diminished blood supply, inadequate nutrition, loss of hormonal stimulation, and aging all contribute to atrophy. Hypertrophy is defined as an increase in cell size. This cellular response is predominant in cells that are unable to undergo cell division. Hyperplasia, overall cell number increases. Various types of anemia, for example, result in an increase of the total number of erythrocytes. Metaplasia occurs when disease or injury results in displacement of one cell type by another. That may be less mature. This is classically seen in vitamin A deficiency. Dysplasia is deranged cellular growth and can result in abnormal size, shape, or structure. Cellular injury can also result from invasion by microorganisms. This presence of organisms is most commonly referred to as infection. In order for an infection to occur, 3 contributing factors must be in place. The pathogen must be present. The host must be susceptible to the infection, and the environment must be conducive to the pathogen's survival. Many things influence an individual's susceptibility to infectious disease, to include gender, age, nutritional status, physical activity, hormones, and stress. Malnutrition can cause immunodeficiency. Microorganisms involved in human disease include bacteria, fungi, helminths, protozoa, prions, and viruses. Microbes are more likely to result in infection if they produce exotoxins and endotoxins. When an infected patient is evaluated, particular symptoms and signs will correlate with stage of infection. Stages of infection include incubation, prodromal, acute, and recovery convalescence. The incubation period is the time between entry of the microorganism and appearance of any clinical sign or symptom. The prodromal period is when the individuals begin to experience the first, even vague symptom of infection. During the acute period of infection, the disease will fully develop. Finally, as symptoms begin to resolve and signs subside, recovery and convalescence will proceed. If the injury, agent, or disease process is severe enough or continue for long enough, the cell will reach a point where adaptation can no longer occur. Necrosis refers to the cellular change that occurred during cell death. Apoptosis, pattern of cell death genetically programmed, which allows for removal of cells in a systemic, orderly fashion. In order for infection to occur, the host has to be susceptible to the infection. Susceptibility occurs when there is a break in the host defense mechanism. The first line of defense against infection is the host's intact skin and mucosal membrane. In addition to providing a physical barrier, skin and mucous membrane components produce chemical barriers such as lysosomes produced by sweat glands. Body secretions such as saliva, tears, and gastric juices also protect the host. Tears, urine, and saliva serve to wash organisms out of the mouth and eyes. Preventing transmission is the basis of the clinical approach for infection control and prevention of disease. Microorganisms can be transmitted from one human to another through contact with bloody and body fluids, as seen in the transmission of hepatitis B. Contact with respiratory droplets is a common mode of transmission. Creating an unfavorable environment for microorganisms include not only preventing their transmission, but also interrupting conditions that allow them to thrive. Disinfectants are chemicals and physical agents applied to an innate object to kill an imminent object to kill off any bacteria or microbes. Applying bleach solutions to clean kitchen counters is a typical use of a disinfectant. Antiseptics or agents that kill microbes within living tissues. When drawing blood from a patient, the technologist often swabs the skin with either alcohol or betadine. This is a common use of an antiseptic. Sterilization destroys all microbes. Sterilization results from the use of heat, chemicals, or radiation. The first line of defense against disease and injury is our system of natural defense or host resistance. But if these barrier forms of host resistance are insufficient to protect the body, our next defense is dependent on the actions of our immune system. The immune system not only defends the body from pathogens, but is also very active in homeostasis by helping the body to remove damaged and dead cells. There are 4 basic requirements of an effective immune system: the ability to react with one and only one antigen which lowers the chance that a reaction to a pathogen will also harm the person. Diversity, so it can respond to many pathogens. Adaptivity, the ability to pick the best response to counter the pathogen. The ability to respond to stimuli not encountered previously. The immune system is often described as falling into two major categories: innate immunity and acquired immunity. Innate or nonspecific immunity is the first line of defense against infectious agents, chemical irritants, and tissue injury. Acquired immunity relies on specific response selectively targeted against a particular foreign material to which the body has been already exposed. The response consists of two phases. First, the immune system must recognize the antigen, and the second, it must mount a reaction to it. Organs of the immune system are classified as either central or peripheral. The major organ of the immune system is the bone marrow. Bone marrow is located in the central core of long bones and in other bones such as the cranium. All cells in the immune system are found in the bone marrow, where they are mature and are released. Cells of the immune system originate from stem cells. Peripheral organs. Lymphatic system is an intensively branched network of wall vessels with one-way values that lead to lymph nodes. Spleen is a fist-sized organ behind the stomach and is responsible for degrading of all old red blood cells and is a major site for the initiation of the immune system. The mucosous surfaces, major sites of pathogen entry, are protected by gut-associated lymphatic tissue, bronchial-associated lymphatic tissue, mucosa-associated lymphatic tissue, which comprise about 50% of the lymph node tissue. All cells of the immune system originate from the stem cells of the bone marrow. Monocytes mature into macrophages. In a stained blood smear, monocytes are larger than most other white blood cells and have approximately equal amount of nucleus and cytoplasm. Monocytes and macrophages ingest and destroy bacteria, aged cells, neoplastic cells in the process called phagocytosis. Leukocytes are a second group of cells involved in the innate immune response. The term polymononuclear leukocyte refers to nuclei that looks very different from cell to cell. Three types of leukocytes can be distinguished by shape of the nucleus and stains taken by the granules. The neutrophils is the first type and the most common. It is comprised of 60% of white blood cells in blood and about 90% of all leukocytes. The second type, eosinophils, have a biblial nucleus and are named for their granules, which are bright red and when stained with. The third type of white blood cell is basophil, so named because the granules, which appear blue-black type, take up basic dye. The lymphoid precursor differentiates into cells of the adaptive immune system, including B and T cells. B and T cells share 98% of expressed genes and cannot be distinguished for each other in a stained blood smear. T lymphocytes were named for the thymus gland, the site where they mature. Most of the lymphocytes in blood, lymph nodes, and lymph are T cells. B cells differentiate in bone marrow. The initiation of the immune response depends on our body's recognition of foreign substance, the antigen. Recognition of antigen is possible because our body cells are different from the antigen, and this difference can be detected and communicated to other cells by a set of molecules referred to as the major histocompatibility complex human leukocyte antigens, HLA, play a role in susceptibility to some autoimmune and infection diseases. Two important mediators, complement and cytokines, assist the immune system cells in their function. Cytokines are protein produced in cells that is small, affect behavior in other cells in both the innate and acquired immune response. Cytokines were substances produced by lymphocytes. Later, many of the newly discovered cytokines were called interleukins because they were thought they communicated only with white blood cells. The description of the immune system is often organized in two major branches. One is referred to as innate, non-adaptive, or non-specific immune system. Cells of the innate immune system react with any antigen that can then thus react immediately. Innate immunity involves inflammation. The initial innate immune response is numbered enough to prevent initiation of a disease process. The response does not change with repeated exposure. Inflammation is defined as an innate, non-specific response of cellular injury. Inflammation begins with the onset of cellular injury. The body reacts to injury with both a vasomotor and a cellular response. Signs and symptoms are redness, warmth, swelling, and pain resulting from hyperemia and vascular permeability. Clinical management includes both physical and pharmacological measures. One potential complication of acute inflammation is the progression to a chronic inflammatory condition, process by which structure or function are restored. Nutrition plays an important role. Complication of inflammation and wound healing, dehiscence, separation of wound edges, adhesion, scar tissue that forms between two body surfaces, usually as a result of surgery or injury, contractures, shortening of muscle tissue resulting in immobility. In the adaptive immune response, each B and T cell is programmed to attack one specific antigen, but these cells can interact with other antigens that are closely related or very similar. The adaptive immune system takes time to respond initially, but it improves with additional exposure and responds more rapidly on subsequent encounters with the organism. The primary immune response normally begins with the phagocytosis, which can be sufficient to block infection if virulence of the pathogen is low or the exposure is small. During the primary response to an antigen, some of the B and T cells that can react with the antigen are partially activated, but do not participate in the immune response. These are called memory cells and are responsible for the secondary immune response. Autoimmune disease occurs when a specific adaptive immune response is mounted against self and is consequences of the B and T cells that have the ability to recognize any pathogen. When the autoantibody is found in association with disease, the autoimmune response usually produces cellular damage. Research and development for medical treatment used in cancer as well as transplant involves investigation of how our immune system reacts to different types of antigens. Cancer is caused by progressive, uncontrolled growth of a single transformed cell. Antigraft, transplant between one part of a person's body and another. Isograft, transplant from an identical twin without a pragmatic immune response, allografts, transplant between non-twinned individuals, xenografts, donated organ or tissue is from an animal. Host versus graft rejection occurs when immunocomplement cells in the host rejects the graft. First set rejection occurs in approximately 11 to 17 days. Second set rejection takes months to years for chronic rejection to occur. Graft versus host rejection occurs in bone marrow transplant. Immunosuppression is required both at the time of the transplant and lifelong for the transplant recipient. Examples of the drugs used to accomplish immunosuppression include corticosteroids. For some site and tissue known as the privileged site, MHC matching is not required. Allograft tissue is protected from rejection in privileged sites, such as the anterior chamber of the eye and the cornea, because they are vascularized. Throughout the world, malnutrition is a major contributor to immunodeficiency and poor growth. UNIF data in 2018 indicated that 1 in 4 children are malnourished, and inadequate nutrition contribute to more than 50% of all deaths for children under 5. Combination of factors including insufficient protein, energy, and micronutrients, and not just an insufficient amount of food, are involved in the relationship between malnutrition and adequate immune function. Thus, undernutrition can result from personal choice as well as socioeconomic factors resulting in food insecurity. Nutrients critical to the development and effective functioning of the immune system include vitamin A, vitamin C, vitamin B6, vitamin E, essential fatty acids, beta carotene, psyllium, zinc, copper, iron, sulfur. Most congenital inherited immunodeficiencies are detected in young children because they experience recurring or overwhelming infections. Males are more likely to have immunodeficiencies because many such deficiencies involve recessive genes, often on the X chromosome. Some immunodeficiencies are acquired later in life. The immune system can be suppressed by many cancer drugs, by infection agents, including HIV, or in clinical situations such as burns, where there are severe loss of immunoglobulins through wound output. Anergy is the term used to refer to a situation when the lymphocyte fails to respond when stimulated by antigen-specific receptor. Hypersensitivity occurs when the body's immune system reacts inappropriately to a normally harmless substance within the environment. Over 50 million Americans have allergic diseases. Many allergies are a leading cause of chronic diseases. Allergies are the 6th leading cause of chronic illness in the United States. The prevalence of allergy has contributed to a rise consistently over the past 50 years. Common IgE-mediated allergies involve reactions to pollen, bee stings, penicillin, mold, dust, feather, animal, and certain foods. IgE-mediated food allergies involves the failure of the GI tract to digest a particular food component, a subsequent absorption of the intact food component across the GI mucosa. IgE antibodies activate mast cells, which can cause oral inflammation, canker sores, cramps, nausea, diarrhea, gas, hives, and sometimes respiratory distress. Hives occur when histamine released from the skin cells due to an allergic reaction cause blood vessels to dilate, leak fluid, and produce swelling. Basis for diagnosis of allergy include an in-depth physician analysis that includes the clinical history of reactions, skin prick disease test, an allergen-specific serum IgE test, and an oral food challenge for suspected food allergies. First line treatment of allergy is avoidance of the allergen. Medication includes antihistamine, corticosteroids, and severe reactions such as the cases of anaphylaxis, epinephrine is used to counteract the actions of histamines. Currently, there are no FDA-approved medical treatment for allergies. Delayed hypersensitivity, T-cell mediated allergy, or contact dermatitis include allergies to nickel, latex, plant chemicals, and treatment for delayed hypersensitivity usually involve immunosuppressants by medications such as corticosteroids. Often, individuals assume that all adverse reactions to food result from a food allergy. In fact, reactions with similar symptoms may have quite different origins. A food allergy is an immunologically based abnormal response to food. Food intolerance is an abnormal reaction to food that is not immune mediated. Lactose intolerance or reaction to monosodium glutamate, those are food intolerance. This affects 4 to 8% of children and 2 to 4% of adults in the United States. Food intolerance, there are numerous examples of food intolerance reactions. Histamine is found in cheese, some in wine, some in fish, and many cause intolerance reactions. Food allergies, approximately 3 million adults in the US report allergy to peanuts and tree nuts. Another 6 million report an allergy to fish and shellfish. The most common food allergy in infants and children are cow's milk, eggs, peanuts, tree nuts, wheat, soy, fish, and shellfish. Almost any food can cause an IgE mediated response in the susceptible individual. In most allergic reactions to a food, a person with an inherited predisposition produces IgE in response to proteins that cross the GI lining. These proteins enter the bloodstream because they are not denatured by cooking, stomach acids, or enzymes. Symptoms may appear within minutes to hours. Most occur within 2 hours. The first step in diagnosing a food allergy is to obtain a detailed history and perform a complete physical exam to rule out other causes of the symptoms. Nutrition implications. Food allergies may result in the elimination of numerous foods from the diet. When this occurs without proper guidance from nutrition, adequacy delayed or stunted growth in children, as well as additional nutrient deficiencies in both children and adults may develop. Nutrition assessment. Standard nutrition assessment procedures are conducted for all individuals with food allergies. It is especially crucial to obtain an extensive dietary history. Nutrition diagnosis. Common nutrition diagnoses associated with food allergies include inadequate food, oral beverage intake, undesirable food choices, food and nutrition related knowledge deficit, disordered eating patterns, and poor nutrition quality of life. Nutrition intervention. Once the diagnosis of food allergy has been established, nutrition therapy consists of strict avoidance of all sources of that particular food. Education will reinforce safety procedures, including epinephrine injections. Food allergens exposure can be oral, inhaled, skin contact, or rubbing your eyes. The study of both health and disease is dependent on the successful comprehension of how the body responds to cellular injury and the role of the human immune system in this response. Because malnutrition is the leading cause of immunodeficiency, it is especially important for one to understand the interdependent relation between nutrition and immunity.